All right, today we're going to peel back the curtain on a crisis that's happening right in front of us, the incredible pressure on our local emergency rooms. If you've ever sat in one and wondered why the waits are so long, well, we're about to show you that a packed waiting room is really just the beginning of a much bigger story.
So let's just start with a scene that probably feels way too familiar for a lot of us, a chaotic, overflowing emergency department. And while that's become the reality for millions of Canadians, the thing is, we have to remember, this isn't normal. It's a huge red flag that something in the system is fundamentally broken.
And look, this isn't just a feeling people have or some scary news headline. This is a direct quote, a stark, two-word diagnosis from the Canadian Journal of Emergency Medicine. It's basically a formal declaration from the people on the front lines that the system we count on to be our ultimate safety net is in really serious trouble.
Now, what's so wild is how all these symptoms are connected. It's like a domino effect. You've got long lineups and packed waiting rooms, right? Well, that means ambulances get stuck outside. They can't even offload their patients. That in turn causes treatment delays for everyone, which makes patients so frustrated that some just give up and leave. And all of this is happening while staff shortages just keep getting worse. It's a truly vicious cycle.
Okay, so it's really easy to look at all that chaos and think, well, we got to fix the emergency department. But to really get to the bottom of this, we need to ask a much bigger, more fundamental question.
And here's the surprising part. The research suggests that the answer is no. The emergency department isn't actually the root of the problem. You see, it hasn't failed so much as it's become the catch-all, the safety net for every other failure happening in the rest of the healthcare system. It's become the system's junk drawer, where everything that doesn't have a place just gets tossed.
And this number, just let this one sink in for a second. Somewhere between 60 and 80% of the people in the emergency department are there for one simple reason. It was the only place they could go to get care when they needed it. The system has basically made the ED the provider of last resort, and often the only resort.
And here's exactly how that plays out. The ED has become the default answer for, well, pretty much everything. Can't find a family doctor? Go to the ED. Can't get a same-day appointment? Go to the ED. A problem after surgery? ED. And get this, even when a patient is admitted to the hospital, if there's no bed available for them upstairs, they just stay in the ED, sometimes for days, taking up a stretcher that's desperately needed.
So what does this create? An incredibly dangerous situation. I love this quote because it paints such a vivid picture. The staff are forced to play Where's Waldo every single day. Their job is to find the one truly critical, time-sensitive emergency, the heart attack, the stroke, hidden in a massive crowd. And you can imagine, a delay in finding that Waldo can be absolutely disastrous. Now, this crazy, unsustainable pressure isn't just some abstract system problem. It has a profound and honestly a devastating human cost for the people who are right there on the front lines. That constant stress and chaos, it takes a massive toll. The burnout rates for emergency physicians are consistently some of the highest in all of medicine. In major studies, we're talking about more than half of them reporting symptoms. And this isn't just, feeling tired after a long week. This is a deep state of emotional, physical, and mental exhaustion from just way too much stress for way too long. And what happens when people are that burned out? They leave. They have to. But what's really striking here is the gender gap. For doctors who end up leaving emergency medicine, the median career for women is just 10.5 years. For men, it's 17.5. That means women are leaving the profession a full decade earlier, on average. That's a huge loss of talent and experience.
But, this goes even deeper than just burnout. A lot of clinicians are suffering from something called moral injury. And I want you to just imagine this for a second. You're a doctor. You know exactly what care your patient needs to get better, but you can't give it to them. Maybe there's no bed, or the specialist you need isn't available, or you're just drowning under the weight of too many other patients. That feeling, that's a kind of trauma, and it happens every single day.
Okay, so the problem is baked right into the system. It's a fundamental design flaw. So where do we even begin to fix it? Well, one thing's for sure. We can't just slap a Band-Aid on the ED. This is going to take a top-to-bottom reimagining of how we do emergency care.
So experts are pointing to a three-pronged approach to get things back on track. We've got to fix the basic structure of how care is delivered. We've got to fix how we train our doctors for this new reality. And just as importantly, we've got to fix the culture of care itself.
All right,
Let's break down that blueprint. First, redefine the ED's mission. Let's get it back to what it was always supposed to be, handling true life-saving emergencies. And to do that, you have to hold other parts of the system accountable for providing timely care so the ED isn't the only door that's open. The plan also calls for unifying training standards across the country. And this last one is huge. We have to start treating the psychological health of clinicians as a core part of patient safety.
Now look, those are big, necessary changes, and they're going to take time. But remember that third part of the plan, fixing the culture? Well, there's a cultural shift that can start making a difference immediately. It's a solution that sounds almost too simple, but has the power to make a real impact right now, right in the middle of all the chaos.
And I know what you might be thinking. Compassion? Really? In the middle of a crisis, who has time for compassion? And you know what? That is a totally fair question. When you're completely overwhelmed, it can feel like a luxury you just can't afford. But the science tells a very, very different story.
40 seconds. That's it. Research actually shows that it takes just 40 seconds of targeted, meaningful compassion to make a real dent in a patient's anxiety. We're not talking about long, drawn-out conversations. We're just talking about making a brief human connection.
And the payoff for those 40 seconds is absolutely remarkable. This isn't just some soft, fluffy skill. Compassion is a powerful medical intervention. The data shows it literally improves patient outcomes, reduces errors, and lowers healthcare costs. It makes the whole system more efficient. It's a tool that helps both the patient and the provider, and it directly pushes back against that moral injury we were talking about earlier.
And that really gets to the heart of it all. Fixing this crisis isn't just about saving a medical specialty or making one department run a little better. It's about preserving a core pillar of our society, that promise that when something goes terribly wrong, there is a place you can go and they will take care of you. So the question isn't whether we can afford to fix it. The real question is how we're all going to come together to save it, because we can't afford for it to fail.